Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am Kishore Vellody, and it is my joy to have my co-host for all things COVID, Dr. Andy Nowalk, on the podcast with us today. Andy, as you might imagine, the last time we had talked, we were talking about this thing called Omicron that we were seeing kind of take over from Delta in many areas of the country. And I would gauge to say now probably almost everywhere in this country and around the world, Omicron has kind of become the dominant variant. And so a lot of questions came in. We had a ton of emails, and thank you, listeners, for the emails. It's wonderful to hear from you. And we are so glad to be able to bring these questions to Dr. Nowalk, who can help us answer them today. So Andy, you need no introduction. I'm going to give no introduction. Because you are awesome and you are a part of this podcast, such a friend to the podcast. So maybe we could just start off right away with what's going on with COVID. Tell us about Omicron and things you know about it and things we still don't know about it.
So I think when I think about Omicron, I think about the repeated lessons in humility that this virus and this pandemic have taught us as practitioners, but particularly as an infectious disease doctor. You know, when folks come to you, Kishore, and ask questions about Down syndrome, they look to you as an authority and you give authoritative advice, which helps so many people, myself included, for my son.
Thank you.
And when people have looked to me in the last, particularly I feel like the last 12 months, and have looked to me for advice, I almost feel like I have to put a disclosure statement out there and say, well, I might be wrong next week, much more so even than early on. But as we've said many times, we learn as we go, and I think we know a bunch of things about Omicron now. It has proved to be several things. Number one, it's actually way more contagious than the Delta variant. So when you think about how we've gone from the original, the OG variant, which was the original strain in the United States. And then we went to the Alpha variant, which came to us from the UK, which was more contagious than that variant. And then we thought we were doing great this last summer with vaccination and the like. And then we were introduced to the Delta variant, which was more contagious than the Alpha variant and took over the US in terms of transmission and was quite severe and, responsible for literally hundreds of thousands of deaths across the United States. And then when I said to friends and family alike, wow, this Delta variant's amazing. We don't see anything other than that. It's amazingly contagious. I don't know that anything will displace it. Omicron said, hold my beer, and came forward. So it is significantly more contagious than the Delta variant. And we have seen that in terms of most places in the country have been like Allegheny County, our county, which is in the Northeast. So it got the wave earlier. And our peak of cases last winter was, if you remember, Kishore, around 1,100 cases a day. Mm-hmm. Our peak of cases with the Omicron surge has been 4,500 cases a day. And with the ubiquitous nature of people staying home and doing rapid testing, most of my friends estimate that the real number of cases was at least 2 to 3 times that, if not fivefold. So we're talking about, let's say it's fivefold. We're talking about 25,000 people in a day in our county got Omicron infection. That's on one day. That's 2% of everyone in the county. That's 1 out of every 50 people on one day, not, in a week, on one day. So the contagiousness of this is amazing. So now that we've had millions of cases in a short period of time, the other thing we know is it is not as severe. And that is an absolute fact. There's definitely some contribution of vaccination modifying disease. But even when we look at unvaccinated people who make up the vast majority of people being admitted to the hospital, and certainly with severe disease, we would expect, given the fact that there's tons of unvaccinated people out there, that if Omicron moved through and was as severe as Delta, we would have expected in our county, let's say for UPMC, a bad day in the county was about 400 to 500 people hospitalized in the county at our hospitals. That was the peak last winter. So I said this is ridiculously contagious. It was 5-fold more cases in terms of the peak. So we should have expected, therefore, 2,000 to 2,500 cases in the Pittsburgh area, which honestly would have meant hundreds of people would have died in Pittsburgh because they couldn't get surgeries for appendectomies or antibiotics for urinary tract infection. That would have filled every hospital in Pittsburgh with only COVID. So what did we actually see? About 300 to 400 people admitted to the hospital at peak, which is now coming down. So what that tells you is when we expect 2,000 to 2,500 and we see 300 to 400, this is much less severe. The vast majority of all those people were unvaccinated. So we know it's much less severe. We do know that vaccine worked. It worked actually in a way that we had no right to expect. Remember the vaccine that we all got, hopefully if you're listening, you got, or your child got, or your loved one with Down syndrome got. That vaccine was designed against not Omicron, not Delta, not Alpha. It was designed against the original strain that came out in the spring of 2020. That is what all the genetic sequences in that vaccine represent. So we are, as I said, 4 generations down the road. It would be very reasonable to expect that the vaccine would have no effect. But I will tell you, it was amazing in terms of its effectiveness. So what we saw, and there is good data coming out from CDC right now about this, that it protected against hospitalization by a factor of about 10-fold. So you had a 90% chance less of being hospitalized if you were vaccinated. The protection against death was like 95%. And the protection against any infection looks to be about 5-fold. So you were 80% less likely to be infected if you were vaccinated. And if you were boosted, it was even a little bit better. This vaccine will go down in history as being one of the greatest scientific achievements that we ever saw, that they were able to get this to market, put it on market, vaccinate all these people, and save millions of lives around the world. And
So,
then,
Andy,
go ahead.
I was going to say, you bring up a really good point that I want to make sure that we highlight, because having spoken with an unvaccinated person recently, and I was talking to them about the effectiveness of the vaccine, it really does seem that depending on the media sources that one chooses, you may not hear these things. So what they were telling me was, what I'm reading is that vaccinated or unvaccinated, you're still going to get the disease, so why get vaccinated? So your response to that would be?
Nonsense. So here are the things that work. Masks, they still work. And I've read everywhere, masks don't work anymore, don't wear them. That's made up. That's pure nonsense of people who don't like masks. We know that masks still continue to work. If masks didn't work, what you and I would see all the time in our hospital are providers who are wearing masks infecting patients who aren't. We'd see that daily. You know what we have seen at our hospital so far? Documented provider with COVID masked, because we all are, to a patient who's not wearing a mask, 0. We are 2 years in and we are at 0. Masks still work. Now, this is a very contagious virus. So if you take your mask down, or if you're wearing a cloth mask, you are at more risk because the virus is pretty contagious. But particularly if you put a cloth mask on someone who's infected, it still works great. And if you put a mask on anybody, even if they're not infected, it's still going to help. Masks work. They still work. That just frustrates me so much when I hear that.
Yes.
And then vaccines don't work. We have this staggering amount of data from the CDC of millions of people who were infected with Omicron in the last month and a half. And it's clear the vaccine works amazingly well. It works better than I ever thought it would. I didn't think it would work this well, and yet it does. A little story of vaccination. So 5 to 11-year-olds, right, got approved for vaccine in early to mid-November, and we were able to start vaccinating them. So that group got their primary series in mid-November and typically early December. So that group in our county in mid-November, this is publicly available. You guys can go check me on this. Same in our county as in the United States, had the highest rate of COVID positivity, and by a 2-fold margin had the highest rate of cases more than any other age group. So keep that in your mind. They have the highest rate of disease because none of them are vaccinated. Then we vaccinated all of them. and then Omicron came. So what happened to that group is you would expect if vaccines didn't work, right? They should have a twofold higher rate of infection because they're all in school together. Well, they didn't have a twofold rate higher level of infection. They didn't have the same rate of infection as other groups. They went to 6th among the 8 age groups that we tracked. They dropped for a period of time while Omicron cases were rising in every other age group. So that age group tells you that just the primary series provided amazing protection. Vaccines work. They work amazingly well. If you've chosen not to vaccinate yourself or your child or your brother or your sister or your uncle or your aunt with Down syndrome, you can still save their life today by getting them vaccinated. Literally save their life. Go do it, please. You could save their life. You could save your own life. What we all want to do is protect our loved ones. Go and do it. It works.
Yes, thank you, Andy. I think that couldn't be clearer, and I think the data also couldn't be clearer. So I appreciate that. And I think one thing is we're obviously a podcast focused on folks with Down syndrome. One of the questions that we got in an email, as you know, and I know as well, that we see a lot of sinus infections, ear infections, but pneumonias as well in people with Down syndrome. In fact, we've talked about that years ago on this podcast, just these types of risks. So we've heard that Omicron tends to be more of an upper airway infecting virus more than a lower airway compared to the prior variants. So have we seen, or do we know that this is a good thing for this current variant to not be such a lower airway infection causing agent in people with Down syndrome?
We don't have specific data, obviously, but I think the logical assumption you made that if something is going to go to the lower airways less frequently, that's going to be good for a population of people who, as we've talked about, the number one cause of death among all adults with Down syndrome is pneumonia. Then that's got to be a good thing. We certainly know from data that you and I have talked about before that the picture became clear over time with really good research that people with Down syndrome, when they get COVID, are at increased risk of being hospitalized, being in an intensive care unit, and dying. And that risk factor is not trivial. I mean, it's significant. So anything we can do to lessen the risk of lower respiratory tract disease, that is pneumonia, is going to be good. And so I think that actually the way this strain has been working is something that will be good for all people, but particularly our folks who have Down syndrome.
Awesome. And we're going to talk more about vaccine here in a little bit in the podcast. But one family member had reached out to me saying, actually, many people have reached out to me, even not formally through an email, about having a child under 5 and having this fear of it's going to take a long time for the under 5 vaccine to finally be available, and yet Omicron is raging. So they say, is there a reason, because of Omicron's tendency to be less severe to the individual, for them to not have to have as much anxiety about Omicron for their under 5-year-old?
So I think of this a couple of different ways. It is certainly less severe. And what we know is that children get less severe disease than adults do from all strains of the virus, all variants, including Omicron. So that's good. But I also want to fight against another myth. So myth number 1, vaccines don't work against Omicron. Nonsense, BS, crap. They do. They work amazingly well. Told you about the data. Mm-hmm. Number 2, masks don't work against Omicron. BS, crap, absolute nonsense. Told you about some data. Number 3, coronavirus is benign in kids. I've taken care of kids in our hospital who died. And they tend to be children who have significant, what we call comorbidities. They have medical diagnoses that make them more susceptible. And among those medical diagnoses are things like neuromuscular diseases like cerebral palsy, respiratory diseases like chronic lung diseases caused by prematurity, immune suppression like an organ transplant or a child with leukemia, or independently, Down syndrome. So we have seen, you and I have discussed this, some very severe cases of disease in kids with Down syndrome in our community. So while I would say I would feel a little better about Omicron, let's just talk about this. There have been more than 1,000 pediatric deaths from Omicron or from COVID so far in this pandemic. And the vast majority of them have been this year. So, and that's CDC data without Texas and Florida, which have enormous populations of children reporting any data for more than 6 months for political reasons, which just drives me up a wall. So probably we've had 1,000 kids this year alone die from COVID. This is not a trivial infection in kids. And yes, you should do everything you can to protect your child from getting this, including what are the best ways? You're going to think I'm a broken record, but this is not a repeat. He's not replaying an early part of this podcast. You should mask and you should vaccinate, because those are easily controllable ways of making sure you put your child at the lowest risk possible. Very sadly, among all of the age groups in pediatrics, the 0 to 4-year-old age group has the highest rate of mortality from COVID. And it's not a trivial number. I mean, it sounds trivial because it is, in reported cases to the CDC, about 1 in 1,000. And given reporting and all that, it's probably much less than that. But that means that several hundred children under the age of 4 have died from COVID. That's unacceptable to me. And also, I'll point out that if you take all children under the age of 18, our worst flu season is a couple of hundred deaths total across all ages. I'm telling you that more than 300 children have died so far under the age of 4 from COVID. That's a tragedy. So I'm not telling you to be paranoid, but I am telling you that just because your child's under the age of 4 and they're less likely to get severe disease, please take the smart things that you can do and keep them protected. Masks and vaccines, keep them in mind.
Okay. All right. And I think folks who are paying attention to the news over the last couple of days, we're starting to hear about this new variant. I don't know what relation, we'll say a cousin or a little brother of Omicron, who has the name currently, uninspired name of BA.2, I guess. What do we know? What do we not know about this variant?
Well, as I was saying to you before we started this podcast, this is like asking me on the day the Omicron variant was discovered in South Africa about what to think. They have been able to track this across the world. And these days, honestly, South Africa took a lot of grief for the Omicron variant. When folks looked at Omicron detection afterwards, they realized it was all over the globe. And we have a lot to thank them for providing us key information about it. This subtype has been detected across the world, and we don't have much information about it. So far, it does not look like it's dramatically different from the rest of the Omicron variants. So this isn't even classified as a different variant. It's not being given a name, pi, which, is, I think the next name that's up, which will make me think of, apple pie and strawberry pie and the number pi, which goes on for a long time, much like this pandemic. But, nobody's going to call it the pi variant. So I think we just have to see. I'm guessing, and I've been wrong so many times, you can probably turn off the podcast for a minute if you want to break, but I'm going to guess it's not going to look dramatically different from Omicron. And, just to return to Omicron, there are a couple of things that I like about it. For example, the incubation period, I forgot to mention that up front, definitely very short. And that's begun to help us a little bit, as I thought it would in the long run, because simply people have less opportunity to infect other people, particularly travel. They don't have time to travel broadly and infect a ton of people with asymptomatic shedding. But the other piece is, and this is very preliminary, but the data that I've seen is very interesting. It looks like that there, for example, if you were unvaccinated and you got infected with Delta, it provided you no protection essentially against Omicron. It looks like if you got infected with Omicron, that it actually protects you from Delta a little bit, which will probably cause the effect that Omicron will be the main variant that we'll see in the United States for a very long period of time. And I actually find that a little bit reassuring.
Okay, that's good.
I see. I said something happy.
I love that. And as you might imagine, several questions were sent in about vaccine, and so I wanted to just ask you. And this one comes up a lot. It's about the the concern for potential long-term side effects to vaccination. As we've shared on this podcast, so many vaccines have been out for a long, long time, and we know their safety record, and we know that 50 years out, getting a diphtheria vaccine is probably not harmful to your child. In fact, it's not harmful to your child. But how can we know that with any certainty with a COVID vaccine before we start immunizing our children?
So, it's a great question. First of all, I want to compliment the listeners. I think everyone who's asked questions always asks such good and relevant questions, and they're often the same sorts of things that I'm worried about too. But I get this question a lot, and it's frustrating to me. In the history of vaccines, we have never, ever, ever seen a vaccine cause a side effect 2 years later, other than being alive and free of that infection. As some T-shirts that I love say, vaccination causes adults. And I think about this a lot, right? Vaccination saves lives, and I can't cite you not a single instance of a vaccine that caused a side effect 2 years down the road. You could definitely say to me, well, this could be the first. I guess it could, but why would this act differently than every other vaccine that we've seen in history? We just don't see late side effects. What we see is the vaccine prevent the late side effects of the infection that it was meant to prevent. For example, as you and I know, when we were taking our board exams, we had to learn a lot about measles. It was tough because we had to learn a lot about measles without ever seeing measles. And why did we never see measles? Because we have a great vaccine. But if you turn the clock back to the 1940s, we knew that every child got exposed to measles typically before the age of 5. And we know that it killed several hundred of them a year. We know that it caused lots of long-term disability from encephalitis in a larger number. And we also know that, 8 to 10 years down the road, a number of children would experience a severe neurologic decline and death from something called subacute sclerosing panencephalitis, a rare side effect of having measles, but something that happened in a certain number of children. So that is a side effect of a disease that happens way down the road. You know what happened after measles vaccination? That disappeared completely because the measles virus, which is a live virus vaccination that's attenuated, doesn't cause anything like that. In fact, it protects you from that side effect. So while I would say I respect the fact that people want to be careful about what they put into their children, and I invite questions about it, we have no reason 2 years down the road, having seen no long-term side effect, to suspect that these vaccines will have any capacity to cause them. What we have seen? We have seen long-term side effects, and it's come from COVID. Long COVID, heart damage, lung damage, and then those, fatigue and other long COVID symptoms. We've seen lots of long COVID symptoms. We haven't seen any symptoms long-term from the vaccine.
I wonder if if you add this to your myth list, or perhaps it's already on your myth list, but I think one underlying concern that families have mentioned to me is that this is a new vaccine technology. It's changing my child's RNA. We can address that. It's changing my child's DNA. Why would I want to give that? So how would you answer that particular concern?
So, I think that just goes back to understanding a little bit of the science, which can be challenging. But, everybody's familiar with DNA, thankfully. So we all have DNA in our cells. It's the blueprint for us, right? It's really critical to understand that's our blueprint. And many viruses actually don't have DNA. They're made up of a cousin molecule called RNA that is their blueprint, that they will turn into more copies of RNA. But the key thing to understand is the way that the vaccine works is it's not working with the kind of RNA that you use to store information. They're working with the kind of RNA that is essentially, I hate to shout out 70s TV shows, Kishore, and I can see you're nervous already. He's like, where's he going to go with this? So I was a big fan of Mission Impossible. I love Mission. Remember Mission Impossible? Yeah, great. You get your mission. Tom Cruise does it now. He gets his mission. and it's a recorded message. And at the end of the message, it's always like, this message will self-destruct in 5 seconds. And then
Yes.
it bursts into flames or smoke comes out of the stuff. So it's a self-destructing message in Mission Impossible. That's what mRNA is. It doesn't stay around. It doesn't go into your DNA. It's a self-destructing message. It is essentially Tom Cruise delivering a message to your cell saying, I want you to make spike protein to make this body immune. This message will self-destruct in 5 seconds, which it does.
Yes.
If you would go to me, having been vaccinated with my booster 3 months ago, and try to find any evidence of that messenger RNA, or honestly, the spike protein that it produced, you wouldn't be able to find it. If you go to any child a month after vaccination, you won't be able to find it. It is a Mission Impossible style self-destructing message. So it's gone from your body. It literally is completely impossible for it to become part of your DNA. That's just not how that pathway works.
Wonderful. And then we have another group of folks, Andy, who have felt like the data on the vaccine, as you've shared it on this podcast and is out there very easily found on reputable websites, saying that, hey, vaccine works, and they're on board. And they are so on board that when the CDC releases and says, if you are immunocompromised, you can get your booster early, or you can get a 4th dose and things like that. So they wonder, well, if my child just has Down syndrome and no other underlying conditions, should I consider them immunocompromised to get early boosters? What do you think?
So that's a tricky question, right? And you and I both followed these debates in that we know that we've always had questions about how the immune system of people with Down syndrome function. And it's clearly put them at increased risk for severe outcomes from COVID. And so you could take those data and say people with Down syndrome are immune suppressed. However, that's a more complicated question in a lot of ways. And so when you look at why everybody with Down syndrome dies of pneumonia, for example, as an adult, one of the reasons is they never die of cancer, because people with Down syndrome, they don't get cancer typically as adults. And they don't die of heart disease because people with Down syndrome don't get heart disease as adults. But they do get dementia, and they do get some other things that are associated. The most common reason for people to die from dementia is from a pneumonia. So, that's a sticky thing to tease out. So in this setting, I don't know what the right answer is here.
Yeah.
I think that you have seen some states around the country actually go ahead and say in their state, Down syndrome qualifies the same way immune compromise has. And some other states have said it does not. And they're both right. And they're both wrong, depending on how you look at the data. So I don't have know me, I love clear declarations and powerful statements and getting on my soapbox. I don't have a clear answer for this other than it doesn't technically qualify in the same way as we think of immunocompromise from chemotherapy or an organ transplant, which is mostly what we're talking about immune compromise.
Yes. Okay.
What do you tell? I'm interested. What do you say to patients when they ask you that?
So in pediatrics, we generally, in the national kind of discussion that we've been having, people who do these types of things have not been considering, at least for sure, children with Down syndrome as immunocompromised for the early booster needs and things like that. We're assuming that they're making an immune response to this vaccine, and so we don't need to early boost them as we would, as you said, perhaps an immunocompromised child who's on chemotherapy or something like that. You're right, though. The harder question is really for my adult colleagues who take care of adults with Down syndrome, because we know their risks for pneumonia go up exponentially as they get to be older than 40. And that's a question I think that there is some back and forth about whether or not we should be early boosting for COVID and things. So it's,
I don't know the right answer here, to tell you the truth, because I think that this is not like masks unambiguously they work, vaccines unambiguously they work. This is, you could make a cogent argument on both sides. I think that's a really tougher call, as you said, for that older population, certainly. Did I think about that while I was waiting for my 15-year-old son to become eligible for a booster dose? I did. Did I wait for the booster in the regular schedule? I did. And, if you find, particularly on this subject, that different states and different countries have conflicting policies. This is an honest misunderstanding. It's not a dishonest misunderstanding, which is the bad information being spread about masks and vaccines, which, to be completely blunt, is often spread in the pursuit of politics or money for a lot of people. They're often selling you something. This is an honest misunderstanding or disagreement about policy that I think is probably a good one for us to have.
Yeah, yeah. And this next question is going to be, I think, a pretty quick one for you, which is, do we have any data that says that when you boost somebody with a third dose of this vaccine, do we find that people with Down syndrome have any additional risk compared to the rest of the population?
We don't have any data on this. I have to say that I've been very pleased when we've looked at the booster data. We have not seen in most of the booster data, those side effects be much, much worse. Everybody had their own experience with booster side effects. I will point out, not the worst vaccine that we have in terms of side effects. Ask any adult who got the new shingles vaccine. It actually has a much higher rate of side effects. I'm due for it in a couple of years. I'm not looking forward to it because it sounds even worse than some of the side effects we've seen. But importantly, in the teenage group, we've not seen a dramatic increase in myocarditis. And in the younger kids with the primary series, as expected, we saw very little myocarditis. Myocarditis comes up a lot because it was a side effect, a rare side effect, but a side effect of the vaccine in the age group that gets the most myocarditis, period, which is adolescent males who, for infection or autoimmune myocarditis, are the number one age group. And so unsurprisingly, we're the number one vaccine group to get that side effect. But I want to emphasize again, you may have heard that in the news. It causes myocarditis. It causes heart problems. We have found that myocarditis is very benign, as opposed to the myocarditis caused by COVID infection, which is lethal, or that MIS-C syndrome, the multisystem inflammatory syndrome you can get after COVID infection in kids, which is also lethal. And that myocarditis has been responsible for 60 deaths in the United States alone in this pandemic. That's not the infection itself. I'm talking about after the infection. So that's something to think about, that, we've seen 60 deaths alone from MIS-C, all of which it seems were preventable by vaccination.
Yeah. And Andy, I think one last kind of topics that the families were asking about. This one is, when is this vaccine going to be available for those under 5? We've talked about how effective the vaccine is. In fact, on the last podcast, we talked about how the Pfizer trials showed that with the 2 doses that they were giving, there wasn't as much of an immune response as they would have hoped. So now they're trialing the 3rd dose. We hear that Moderna is doing some trials on younger children. So when are we going to start to see either one or the other available for kids under 5?
It's possible. And again, I work for neither Moderna nor Pfizer, so I don't have a conflict of interest. I also don't have anybody from Moderna or Pfizer calling me up to tell me the inside scoop about what they're doing. The word on the street, for as reliable as that is that we may, Pfizer's been leading the way. For example, Pfizer was first to get adolescent vaccination. Pfizer was first to the 5 to 11-year-olds. The word on the street is that Moderna may actually make it out first for the under 5-year-old crowd. So that's what we have heard. I don't know. I bet it'll be sooner rather than later. So we're hearing some promising signs that we'll get some vaccine in that age group. And that will be good. I know a lot of friends who have kids under the age of 5, in particularly a bunch of colleagues who've had new babies in houses, and they're just feeling lost because they don't have access to the vaccine. So I hope that's going to change pretty soon.
Yeah, no, that's what the person who emailed me this question was saying, that they feel kind of lost in the shuffle. People keep saying, like we keep saying, vaccination is so effective, and yet they feel out of the loop because of their child under 5. Is there going to be an Omicron specific vaccine at some point? Or are we going to let Omicron kind of blow through and say that our current vaccine is good enough?
Well, that's a really good question. I think that I have heard nothing from the vaccine companies that they're going to change their production lines right now. I would imagine, let's throw out a scenario, which by no means I'm not throwing out my prediction. one scenario that we might see is that we have this very, 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 very big peak of Omicron.
Mhm.
And it goes down very fast, which it has. I mean, Kishore, I was looking at our county's data today. Our peak was 2 weeks ago. Our case rates are down 75% in 2 weeks. It's remarkable. So you could envision a world where Omicron sweeps through, provides a little bit of immunity, and more people continue to get vaccinated, and we get to a winter that's relatively free of COVID compared to the last one. If we see that and we vaccinate most everyone, there is definitely talk at the companies that the boosters that inevitably I think we will all be getting next year, or this year, I'm sorry, it is this year now. I think in the fall to winter of this year will contain updated sequences. And the beauty of this technology is with influenza, that would have been so challenging to do. The beauty of this technology is essentially, if you can imagine it, it's like a cartoon of a guy in a giant factory just going and pressing a button and then walking away. It's very, very easy to change the sequence of this on the production line and adapt it to Omicron. I would imagine that Omicron will be the sequence that the boosters would be based on in the fall. I'd be surprised if that were not the case.
Awesome. Andy, I have to say, I mean, obviously we did not plan to have this in-depth of a podcast as we were going, but there's so much great information. I feel like you and I were just having a conversation, and we've invited our thousands of listeners in on this as well. I really do thank you for your time and your knowledge today. I appreciate that.
Thank you for having me back. It helps me feel better about myself when things change quickly. The one point I will make is I'm not mostly talking about data that is some sort of secret stuff that you and I can look at, or that only I can see. The vast majority of the things that I am talking about, as you know from those emails that you get from me every week, because I do an update email for a lot of folks around our hospital on a weekly basis, they're straight from the CDC, the WHO, the New York Times. They're all publicly available sources. So if you don't believe me, just go to the CDC website. Their information is really well organized. It's just all publicly reported data. And it's great. It really tells you the tale of the fact that masks work and vaccines save lives, and that pediatric COVID is important. So we need to keep working on protecting our children, especially our children and our adults with Down syndrome who we love. So this is not privileged information. This is out there. And I just want to keep pointing people towards those sources. Twitter is not an acceptable source. Facebook is not an acceptable source. Instagram is not an acceptable source. Joe Rogan is not an acceptable source. The data is there. Go look at it. It is astonishing and clear that these vaccines work and masks work. So just go look at it.
Awesome.
I'm not talking about stuff that's privileged.
Awesome. Thank you. And for our listeners, I hope you learned as much as I did during this podcast. And I also hope that you feel, as I do, a little bit of optimism that things could be changing, hopefully for the better. Of course, we don't know for sure, and the crystal ball is still very cloudy, but I'm feeling hopefully 2022 a little better than we did this time in 2021. As you know, there are many, many topics that we could be discussing about Down syndrome, and many that we have discussed on this podcast before. If you have COVID related questions, please do send them. If you have other questions that you would like us to answer as well, don't hesitate to reach out. Down Syndrome Center at chp.edu is our email address, and you can reach out with any questions you have. If you want to join us in what we're doing, supporting our center, including this podcast, please do go to givetochildrens.org/Down Syndrome Center, and we would really appreciate that as well. But until next time, bye-bye.